Hi, it's Dr. Shelley, and I have a really good video for you today. Many of you have asked me, what should I do the week of the test? What should I do the day before the test? What should I do, Shelley? Like, just tell me like what you think I should focus on. All right, so listen, this video is what you need the week before the test. So let's get started, shall we? It's a quickie, so let's go. If your test is coming up in a week, the week before you have to be strategic and plan that bad boy out. Listen, I put it all on the board the week before you test, and I'm going to go over every single one of these, but you do need to know that I'm basing it on a lot of the things that you use in my program. Now, it doesn't have to be my program. You can use whoever's program, but your focus has got to be the same subjects that I talk about that every program probably has, right? I'm not the only program out here. All right, so here we go. Call off dead. Call off your job dead. Tell them Dr. Shelley said I cannot work before my test. Now, you got to be strategic with this, right? So if you know that your test is coming up in a few months, don't be calling off to go on to a concert or something with your friends. You done sat up here and called off for Taylor Swift. You done called off for Beyonce. No, honey, save your time. And don't feel bad about calling off, because when you return, you'll be a nurse. So it doesn't matter anyway. But what I'm saying to you is the type of grind that you need to be on the week of your test is not going to be accommodating 3 12-hour shifts in a week. And even if you don't call off for the whole week, which, you know, you'd financially have to plan for that, at least call off the weekend before your test. I'm telling you, when people don't listen to that advice, it doesn't go well all the time. Okay, just try to take time off. That's the point. Number 2, you know by now that most of the information on the NCLEX exam is contained in our pink packets. There's 8 total, but there's some that you need to focus on the week before you test. So it says review pink packets every single day. Now, up until this week, you should have been looking at something pink every day anyway. And so remember what the pink is. And I've actually brought them here for you. Obviously, this is the most important pink packet that you should know inside and out. But if I had to pick the next most important packet, I'd have to pick the one that you guys are failing in the most. Procedures and reduction of risk. So these two, oh my God, and procedures, reduction of risk, they're a big focus the week before your test. But then don't sleep on this, right? Because why? The test has added, the Ngn Nclex has added more questions on infectious diseases, which is what that packet was. And then they also added more pharmacology. So when we look at these 4 packets out of the 8 that you have, these are the most important packets. You are focusing on, oh my God, you're focusing on procedures, you're focused on the medications, and you guys know that I updated this for 2024, and then you're focusing on infectious diseases. With the real rationale being with infectious diseases and pharmacology, the medications, the difference between last year's before April, the old test and the new test is basically more pharmacology and more infectious diseases. When I look at all the tests in the past and the ones now that you're taking and what your performance has been on these tests, I will say this: the number 1 area of failure is basic care and comfort and reduction of risk with procedures. So that's why I put that at the top with the oh my God packet for you to look at and look at well. And it's a lot. So remember, you're not just looking at it, you're trying to absorb it, okay? So those 4 packets are huge. Now look, you need to understand that psych is huge on NCLEX. It is one of the only subject areas that they pulled out and made a subject all of its own as a focus of NCLEX. In other words, they didn't pull out cardio and put it on your case report, your candidate report. They didn't pull out respiratory and put it on a candidate report. They didn't pull out cancer or endocrine or renal or acid base and put it on this candidate report. No, but you do have a separate category just for psych. And I want to make sure you know that the English second language student fails psych the most. It's just not a black and white subject. It's a very gray area. Depending on the culture, it's going to be handled very, very differently. So that's why a lot of students don't do well in it. So what are you going to do to bump up your psych? You're going to look at psych videos. You know I have a good 9, 10, 11 videos that you should be looking at that is all psych in the psych playlist. You go to the playlist on the HETV, you go straight to that playlist, and everything is controlled by the playlist anyway on my HETV, right? Just in case you forgot, HETV is Health Education Television, and that's where all the playlists are anyway. So when you go to the playlist, you're looking up psych, and you're going to see chapter 1, psych personality disorders, and you're going to see depression. You're even going to see the SSRIs for the depression. Then you're going to see bipolar, and then OCD and PTSD. Don't sleep on psych. Look at every single psych video. If you were smart enough to get UWorld, do all the psych meds questions in UWorld and do all the psych questions in UWorld. Psych meds is about, in UWorld, is about 35, 34, 36 questions. And so I want you to get your butt in there and do all those psych med questions. And then remember, if you have this pink packets, psych meds. Now why? Well, let's remind ourselves about meds and how it works, because this is the week before your test. You gotta know your shit. Psych, when you look at all the meds on NCLEX, the number 1 category of medications is psych. The number 2 category is cardio. Number 3 is actually GI, okay? So you gotta know your psych meds. All right, so you focus on your psych. You pulled the pink packet psych meds out. All right, good. Number 4, you are doing 150. So you're going to have to try to do like 85 on UWorld if you have your UWorld. And then whatever's left over, you got to make sure you put unused for maternity. Review those rationales. It's going to take a minute. You don't write them down. You're just looking at them. You're going to do 150 combined peds and growth and development. Okay, you can combine those, all right? So you're doing the peds growth and development, you're doing the peds, you're doing the maternity, and you're doing the psych. Those 3 are huge. And just in case you didn't know, in the Oh My God packet that I was showing you, let me just make sure you know this, because maybe you're gonna forget this, but in the Oh My God packet on page 5, it says this right here. Look, y'all, the week of your test. You see that? It's all right here. Look at that. Peds, maternity, psych. Okay? So you can't be messing up. All right. Now, so you've got that done. Now, you have another category that is very tricky on the test. The category is management of care. This is your prioritization, your delegation, your ethical, legal. It's a bunch of stuff, and it's just so important that you understand advanced directives and DNR and hospice versus palliative and malpractice and torts and assault and battery and the board of nursing and the scope of practice and yada, nada, nada. So what are you going to do? You're going to make sure you watch all of the management of care videos and review the management of care pink packet while you're doing it. Remember, this is alphabetical, so it's really easy to follow along. And I'm teaching right off of this on the videos. So, I mean, come on, guys. Okay? Now, number 6. Here's where you really gotta be conscientious and self-disciplined and really honest with yourself. You need to do the UWorld RN assessment. You will probably see it's 100 questions. You must make sure that you get a very, very high, I think it's called very high, or in my book, because that's all that matters is my book, because my book pretty much gets you a ticket to the licensure. In my book, I always say you need an 80+% on that test. 85% would get you in the door, y'all. It'll get you that license. So try your best to get that score. But when should you do this test? When should you do this UWorld RN assessment? At least 48 hours before your test, so that if you suck ass, you can reschedule that test. Don't be stupid. It told you wasn't going to pass and you went anyway. Come on, where they do that at? Okay. All right, now listen. Number 7. You got to pray. You got to turn it over to God, especially if you're taking a test and you expire soon, like you have an expiration date on your ATT and you can't, you don't have a choice. You can get your ass out here and take that test. We tell you, do not waste the money. Do not just let it slide. You might pass. We just had a young lady in class the week or 2 ago. We put the video up. She had to take her test and I'll be damned, she passed that test. So really, really make sure that you are just prepared to give it to God, because at a certain point, there's nothing else you can do. You can't reschedule if it's less than 24 hours. If it's not less than 24 hours and you don't expire and you sitting there feeling some kind of way about the test, take your ass on in there and reschedule that test and quit acting retarded. Yeah, that's what we tell you to do, because it is so expensive and so depressing to have to take this test again. And one of the things I want to tell you, if you're one of those people who failed your test and you are preparing to take it again, and for some odd reason you thought it was a good idea to take it in 45 days from the time you failed it, I can guarantee 99% of you will fail it again. That is the stupidest thing you could do, but you didn't know any better. Now you do. Dr. Shelley is standing here and telling you that the highest failure rate is for those who took it 45 days later. So look at the expiration date. Usually you have 6 months. Some states, very few, 3 months, but a lot of them, a whole year. In my state of Ohio, you get a whole year to get your shit together. Okay, so you don't need a year. No, you don't need a year. But you don't need 45 days. You need more than that, especially if you're doing our program. We do have a 12-week program that we have inside of our YouTube channel. Remember, I put my whole YouTube channel on, I put my whole nursing school on YouTube for free, So every subject is in there under the playlist. But also, if you want to do this correctly, pump your brakes. If you're doing a 45-day thing, stop that shit, reschedule, pump your brakes, go look at the self-study, Ngn Nclex self-study playlist, and go ahead and look at that step-by-step, look at part 1, part 2, part 3, make sure you find that 12-week plan. It'll tell you what subjects to do and even what order to do them in. I am excited for you. This is the best career on earth. It has saved my life. I, dropped out of high school pregnant, went to go live with the baby daddy kicking my ass. And so getting a licensure, a nursing license, meant really freedom from some really horrific things that happen in childhood as well as adulthood. So I want you to experience this wonderful world of nursing, and I want you to do it correctly. This test is no joke. So get your shit together and let's do this. Deuces. I really hope this helped. Oh, by the way, we still do have our sale going on, the 8 for $88. So if you need any of the pink packets, maybe you don't want all 8 of them, maybe you've already met me and you've gotten the Oh My God packet, and maybe you just want to pick 6 for $66 or 7 for $77. Yeah, if you need any of that, just give us a call. But here we go. 216-410-0936. Just text us. I don't really answer phone calls. I hate emails, so I need you to follow instructions. Just text me and we will get back to you. Give us a good 72 hours. Sometimes you're shocked and I do it right away, because whenever you paid your money and text me, I was free. But remember, I work for you full-time in the nursing school that I own, Shelley's Nursing Review. And I also work at a hospital. And I think I deserve time for family, and I definitely need to dedicate Sundays to God because He's been so good to me. You have no idea. That's why I said, give it to God. Yeah, so I'm going now. Deuces. I think that helped.